the next one is actually probably something all of you have dealt with if you live in America. So health insurance companies dictating healthcare, and I actually just went through this. So I don't mind sharing that I have depression, and so my psychiatrist prescribed me a new medication, and because of the health insurance, he had to move me up way too fast on this medication. So my healthcare wasn't dictated by my psychiatrist. It was dictated by Cigna. I'll call them out. It was Cigna. So, and then it actually like made me much more depressed to go up that high, and my side effects were worse. So
basically they wouldn't cover it unless they moved you up.
Yeah, they wouldn't cover, you know, the treatment. They wouldn't cover it unless I moved up. So I'll get more into that story. I know you can all relate. Let's see here.
Cheryl wants us to go 10 hours. Cheryl, I will go 10 hours if you order me Empanada Mama. It's on Allen Street in New York City. I'd like 4.
But you cannot give them your address.
I'd like 5 cheese empanadas. Yeah, I can't give them the address.
No. Leave them at the corner, the Target on Grand Street. Okay. This one's from Newsweek. And insurance providers are increasingly refusing to cover prescribed treatments for many patients with chronic conditions, even when they have fully paid their premiums. If Congress, and then talks about Congress and their healthcare reforms. Basically, let's skip that because that is just about Congress. So U.S. News and Health Report, insurance companies often use a practice called prior authorization. I know that's a very familiar thing for all of you. To avoid paying for a specific treatment or medication, this process requires your doctor to request approval from your insurance company before prescribing a specific medication or treatment. So it doesn't matter if your doctor thinks that's the best treatment for you or not. It's up to the insurance company in the end. The treatment your doctor prescribed will only be covered if the insurance company approves it based on their own policies and often without considering your clinical history. While insurers argue that prior authorization helps weed out medical errors and limits overprescription, studies show it can lead to slower and less effective treatment and an increased burden and cost on physicians. Another thing that they do, and this is, I also get chronic migraines, and so this is something they did with me a lot. So to cut costs, insurers often use step therapy or fail first policies. So for example, Botox is one of the newest, like, well, it's not super new now, but recommended treatments for migraines. But I had to have migraines more than 15 times a month, and I had to have failed 3 different classes of migraine preventative medication before I could get Botox covered. Now, Botox did not work for me, and I hate it because I couldn't move my forehead. I don't have it right now. But now there's this new one, you guys.
Boo Botox.
You guys may have heard about that's like this new breakthrough treatment, you know, FDA approved. So now for that one, I had to have more than 15 migraine days per month, failed 3 classes of medication, and failed Botox before I can get to the new one. It's ridiculous. So basically they want you to do everything that's going to make you worse until they'll cover it. Exactly. I can't tell you how many off-label, I've been on things for seizures. I've been on off-label for depression meds, not for depression, but for the migraines. Like the craziest, like my medicine cabinet, someone said like, don't toss old meds in the toilet. I just have them all in a box, and the box is like this enormous. Anyway. Natalie on Facebook wrote, no shit. I have a friend who has to see long distance out of one eye and up close out of the other because his insurance company will only let him get one eye fixed at a time and will determine for him when he gets the other done. Maybe when he's dead. In the meantime, he can't see that too well and is driving like that. Wow. I'd like to go talk to your friend in the field, Natalie. You know how I could do that? We have a GoFundMe going. I would love to cover a story like that in the field and talk to people like that. Yes. We're almost at 4,000. Can we get 4,000 in the next 5 minutes? I wish we could do Natalie, have your friend email us that story. Email Jordan@protonmail.com. Email Jordan@protonmail.com so we could get more information to cover a lot of these stories. Because as a reminder, folks, we're not only asking for your funding, we're asking for your stories. We get a lot of stories from viewers. Yeah. People are telling me weed. I'm down with the weed. I got it.
Oh, Jen, I don't like the weed.
What?
I personally don't like weed. No, I'm not against it.
No comment.
For me, it makes me hungry, and I eat Taco Bell. Part of the reason I have a colon infection, by the way, I was out for a few days because I have a colon infection.
Jordan
is because I've had some bad eating habits over the years, and whenever I've inhaled marijuana, it's made me eat Taco Bell and bad food, and I've been bloated and gross.
And it makes you enjoy riding on rivers.
Yellow Sun, hi Jordan and everyone, and by the way, happy birthday, Jordan, with some fantastic emojis for cake. Oh, I want cake now.
Oh, you're getting cake.
Laura?
Yes, Laura, definitely. Please do.
No, for the audience, you should read their comments.
They can read. Oh, because the other people. Okay, Laura says, I found some holistic remedies that work great for migraine, Jen. More than happy to email you the info. Please do. Email jordan@protonmail.com.
And by the way, when was it? Was it when I had like 103 fever? I don't remember when, but I had my first migraine.
He knows, Joanna. He's fake news.
I had my first migraine a couple of weeks ago. I think you were there. And I really feel for Jen and other people who have migraines, because that was the worst 20 minutes of my life. It's almost like your brain is literally tearing in real time, and just like little mini fires going on. It's terrible. So, and it's outrageous that insurance companies, and I think this is why we cover Bernie Sanders' fight for Medicare for all and progressives' fight for Medicare for all. Oh, my uncle just texted me, happy birthday, Jordanian, they call me, and all this. This is why we need Medicare for all. We need to get rid of the mental sickness in this country, brought to you as part of the United Corporations of America, that, oh, healthcare is a privilege and you're not entitled to healthcare. No, you are. Because if you're going to live in a civilized society, that means you care about other human beings. And human beings get sick. And human beings have cancers and autoimmune illnesses and handicaps and also mental health, which Bernie Sanders' Medicare for All plan is not just for physical health, but for mental health, as well as dental. So I could tell you plenty of people I've met in Flint that have lost all their teeth because of lead poisoning, among other things. So very important.
Very sad. Yeah, just to finish up this story, the insurer will only cover the medication prescribed by your doctor after the first drug fails. This means insurance companies can force patients to take ineffective medications for months or even years before agreeing to cover the treatment the doctor initially prescribes, which puts the patient's health at risk. So despite being prescribed the medication by your doctors, they can also force you to switch to a similar medication. I know some people, the real one, what do you call it? Not the off-brand, not the generic, but the name brand is the only one that works for them. And they are forced by their insurance companies to switch to the generic, and it no longer works. So it's because they use different fillers and things like that. Insurance companies across the country offer low reimbursement rates for psychologists and psychiatrists, leading growing numbers of therapists to even refuse to take insurance. So then what do people do? And in some cases, insurance companies refuse them. So it's a big mess, and that's why we need Medicare for all. Say it in Bernie's voice.
We need Medicare for all. In a civilized country. No, I don't have a good Bernie impression.
You do.
In a civilized society, healthcare should be a right, not a privilege. Healthcare should be a right, not a privilege. It is a disgrace in our society.
Now you sound like Kennedy.
Every industrial country in the world covers healthcare for its people as a human right and not a privilege. It is a disgrace. Tell me if you like my Bernie.
But you guys heard the Kennedy in there for a bit?
Yes. I keep getting happy birthdays. You know what? Happy birthday. And I want to make a formal announcement that we have now reached over $4,000 for our Patreon in just 8 days. Thank you to Endo, who just contributed $10 and I think put us over the edge. He says, let's roll the coup.
Yeah, I like that, Endo.
And that's what this is all about, baby. Status coup. And maybe let's take a break from the stories and tell them about all the adventures trying to come up with a name for this. You want some behind the scenes?
Yeah.
Oh my God, what a nightmare to come up with a name that you could trademark, a good name, a name that actually matches who we are.
It was a nightmare.
And by the way, I'm brilliant because I came up with this one.
Well, that's not exactly the truth.
It is, but go ahead.
Okay, I guess it's technically the truth, but not all the way the truth.
Thank you, Endo, by the way. Continue.
I don't even know where to start. Okay, so we had all these...
Johanna wants, oh yes, please share the brand story.
Which is what I'm doing, and you just stopped me from.
Okay, let's tell them the other names we considered.
So Cabal was one of them. And just because there was something like, yeah, Kennedy.
I do have back pain. He had a lot of back pain.
He did. He had a back thing, and he hit it.
And he took a lot of drugs.
Yeah, he did.
I'm not on drugs though. I'm only on.
Jordan's very.
I'm only on Nexium
he won't
for
even
acid
take
reflux.
Ibuprofen. It's going very weird. Colin. Okay, what was I talking about? I have no idea. Oh, the brand. Okay, so we had names like Cabal.
Cabal wasn't the first name we wanted. So the name.
Oh.
Not that.
Okay, I got it.
Not that. In the end, I'm happy we ended up with Status Quo. But the first name that I really wanted was Heist. We wanted to name this Heist because I think the United States is basically a heist. It is a giant bank robbery that stole your money over the last 30 years, even before Reagan it started happening. And we wanted to name ourselves Heist because there is nothing I could think of that encapsulates everything. The banks, the lobbyists, the media, the corporations, then it's a one giant heist. That name was taken 6 months ago.
Yeah, so actually it was my fault. I didn't do, we did the precursory, is that a word?
Trademark search.
Yeah, trademark search. And we didn't find anything similar, or I didn't find anything similar. But then, so we went through the process and we initiated the trademark research with a real company, which I never said I was an expert at trademark research. So they came back and said, no, there's someone who just registered it or just started the process. And it was so soon, it wasn't that long ago. So we were devastated, but enough time had passed that they had missed a step and they hadn't taken the next action. So we were yeah, we can get this name, we can do it. So we emailed the guy, we tracked down the lawyer who did the name. I even called the trademark agency and was is there any way we can get this and how? And then one day Jordan's I looked up the address of the guy who had filed this name and I was Jordan, he's in the city. So Jordan's give me the address. So he runs down, he literally goes right away and he hops in a cab. He goes up and finds the guy. And just, I don't know if you knocked on the door and there he was and you're can I have your name?
That's how it is.
Give it to me.
No, he was one of these guys that worked in a WeWorks, which is a co-ed working space. Co-op. So he was in a little corner. It was not a very tiny little office. He could barely fit his legs. And I was hey, I'm the guy that's been emailing you 15 times to see if you're actually going to use this.
We really want it.
And we're all, I'd be willing to negotiate to try and buy it from you. I wasn't going to pay much. And he gave me the death stare and told me, I'll talk to my client.